Okay, can you guys hear me? Okay.
Yes. Are you ready? I'll go
Yes.
ahead and introduce you. Okay. Our next presenter is Jaianna Smith from biology. Her faculty mentor is Professor Veronica Sovero in economics. Um, Jaianna is a senior. She's conducted research with Professor Sovero since fall 2022. She's a member of honors and recipient of Honors Excellent in Research Scholarship. She is planning to attend a postgraduate master's program at UCR. The title of her presentation is The Role of Socio-Economic Issues in the Maternal Mortality Rates of Black Women. Go ahead, Jaianna.
Okay, so I'm Jaianna, and as she said, my title is The Role of Socioeconomic Issues in the Maternal Mortality Rates of Black Women. And also, to mention again, my faculty mentor is Professor Veronica Sovero. So number one, motivation. Despite medical advancements in the past century leading to less maternal mortality, maternal mortality has actually increased within the past 20 years. And one of the most concerning details is that Black women are 3 to 4 times more likely to die during childbirth compared to white women, and overall higher than any other race of women in the US. And as you can see by this bar graph that was created during data analysis, it shows a clear jump in maternal mortality from the years 1999 to 2010, with Black women seen in red with the highest rates. Next is question and hypothesis. So for my question, has racial disparities in the socioeconomic conditions that Black communities face in the US caused increased rates of maternal mortality in pregnant Black women? And the hypothesis is that socioeconomic issues within the Black community are a result of institutionalized racism in the US, which has caused dangerous and even fatal experiences for pregnant Black women. Now, intro and methods. So the problem is that historically, slavery and racism within the US has had a lasting impact on the Black community's socioeconomic status, which therefore influences Black women's access to adequate health care and service from the medical system. Ultimately, pregnant Black women are dying at high rates from preventable deaths. So for my methods, the first part consisted of the literature review, where articles and research were reviewed that were on similar topics to draw a relationship between maternal mortality of Black women and the socioeconomic factors that can cause it. For data collection, public health data and socioeconomic data were collected from online databases like the CDC Wonder, and they were then compiled into spreadsheets to contrast county data of maternal mortality rates by race. And for data analysis, the data was then uploaded into RStudio, which is a coding program, and it was used to configure charts and graphs, visualizations of these relationships. Now for the results, for the literature review, I had to summarize it for the sake of time throughout the presentation. Institutionalized racism within the US has resulted in economic disparities that have produced inadequate care for Black communities. Decades of racial discrimination and biases has also resulted in a large wealth gap between Black and white families that remains distant, very distant till this day. And this racialized wealth gap can lead to a lack of access to resources, which can include healthcare, insurance, housing, transportation, etc., which is due to the socioeconomic issues in the Black community that the government has yet to provide proper solutions to. And it's also important to note that regardless of socioeconomic status, Black women are often not believed and sometimes even mistreated by medical professionals, leading to a level of distrust between the Black community and the medical system. This graph shows the top 10 county rankings of Black women's maternal mortality rates in the US from 2010 to 2016. Some of the key findings of this graph were that 7 of the 10 counties actually have a smaller percentage of the Black population. And yet Black women have an exceedingly high maternal mortality rate in these counties where the Black population is not even the majority, signifying that it is possibly due to racial disparities. And in a report by Greenville, South Carolina, or the United Way of Greenville County, this county did report that there is an issue with racial inequities regarding poverty, income, unemployment, and other conditions. And this county was #1 on the top 10 rankings list. This next plot shows the top 10 maternal mortality rates of white women by county from 2010 to 2016. The maternal mortality rates for white women does appear to be lower than that of Black women. In most of these counties, white women are the majority of the population, so it would be expected that these counties would appear on their ranking list. Macomb, Michigan is a county that is shared on this list as well with on the list with Black women. However, in this county, white people also make up the majority of the population, and yet Black women have a significantly higher maternal mortality rate within this county too. Public sector consultants created a report that found that Black people within Macomb, Michigan were predisposed to poverty, unemployment, lack of equity in education, and other disparities. This plot shows the top 10 county rankings for Hispanic women within by county from 2010 to 2016. Bexar, Texas is a county on this list that's also shared with Black women as well. And once again, although Hispanic women do make up the majority in the population within this county, Black women also have a significantly higher maternal mortality rate. The San Antonio Area African American Community Fund created a report that addressed the disparities in housing, Black education, the criminal justice system, and unemployment, which leaves an impact on the Black community specifically. So what I have here are socioeconomic data variables. It's just a table that includes 6 of the variables out of the 14 that I analyzed throughout data analysis. And I had to omit some of them for the sake of time of the presentation, but it includes uninsured adults, primary care provider rates, income inequality, poor physical health, college degree rates, and high school graduation rates. So these scatter plots, they show trend lines by race for the variables, and the trend line in red represents African American women. The trend line in green represents white women, and the trend line in blue represents Hispanic women. So this scatter plot shows the maternal mortality rates by race versus uninsured adults. So there was an increase in maternal mortality rates for Black and white women as the number of uninsured increases. This would be expected because lack of insurance can lead to inaccessibility to providers and medical care, which is really crucial and essential during a woman's pregnancy. This next plot shows the maternal mortality rates by race versus primary care provider rates. This relationship actually goes against what is expected due to Black and Hispanic women seeing an increase in maternal mortality with an increase in primary care provider rates. So basically, this plot is showing that with more people who have primary care providers, there's actually an increase in maternal mortality. So it could be evident that if maternal mortality rates remain high, despite having access to providers, then there could be a discriminatory factor within how women of color are treated within the medical system. This plot shows maternal mortality rates by race versus income inequality. And this graph aligns with expectations because Black women face higher maternal mortality rates when there is an increase in income inequality. So when there's limited income that's going into a household, this could potentially limit a woman's access to things like transportation or nutrition. And transportation is extremely essential during a woman's pregnancy, as there needs to be consistent medical appointments to ensure the health of the mother and child, as well as having good nutrition and resources to that. This next scatter plot shows maternal mortality rates by race versus poor physical health. It displays a decrease in maternal mortality rates for Black women as poor physical health increases. The correlation values for this plot were actually negative, signifying that the data could have been maybe not reliable enough to show an accurate relationship. However, it could also mean that personal health choices are not driving factors of maternal mortality rates, and other conditions can be looked into. This next scatter plot, variable 6, shows maternal mortality rates by race versus high school graduation. Versus college degree. This plot shows that Black women only see an increase in maternal mortality rates while pursuing a college degree. And so one factor of maternal mortality rates is the lack of education and safe sex education received in school. Even with disparities in the funding of Black versus white education, Black women have actually been able to achieve higher forms of education at a greater rate than ever before. Yet the maternal mortality rates still increases. And this last plot shows the maternal mortality rates by race versus high school graduation. Similarly to the previous plot, education seen to completion results in lower adolescent pregnancies and lower maternal mortality rates. However, this data shows that Black women actually have a steeper increase in maternal mortality despite this progression. So it really drives home the point that achieving higher forms of education or having a greater socioeconomic status for Black women and even Hispanic women doesn't necessarily correlate to a decrease in maternal mortality. Next, conclusion. So the results show that there might be an improvement in socioeconomic conditions within Black communities. And despite downtrends of Black women's maternal mortality rates in certain graphs, it's apparent that Black women do have a noticeably higher maternal mortality rate compared to other races of women. And evidence suggests that in any condition of a Black woman's life, there seems to be a higher risk of maternal mortality. The expected results were that Black women would have a higher maternal mortality rates for each socioeconomic variable, which was acquired throughout the analysis. Scatter plots and bar graphs would depict racial discrimination in maternal mortality rates of Black women, and socioeconomic conditions would also be a factor in the high rates of mortality. And that's essentially what was acquired. Each plot did show higher rates, even though there were plots that didn't align with expectations, like primary care provider rates and poor physical health. Most counties in Black women's top 10 rankings list of maternal mortality also did not have a majority Black population. Next are improvements. So the CDC data was limited due to many counties not reporting their maternal mortality cases, and socioeconomic variables didn't account for the differences in factors based on race. And the use of only linear regression analysis also limited the results. Plots were restricted to only one dependent and independent variable when multiple factors can influence maternal mortality at the same time. To improve, socioeconomic data needs to be specified by race when reported on to give accurate representation of how these conditions affect different races. So policy implications, some policies implemented can be at the medical level. Incoming medical students should receive ethics and cultural training along with addressing any racial bias. which can be important in ensuring that all patients are treated how they deserve, as well as community-based care like clinics and changing the overall medical framework. At the government level, healthcare should be expanded across the country and policies that attempt to fix the racialized wealth gap. Funding of Black education is also essential in improving the socioeconomic status of Black people as it allows for more financial opportunities. Lastly, the reporting system for health and socioeconomic data should be required. Every county and state should be required to upload this data, and as this information can be potentially used to campaign in solutions to problems that people are affected with. Data also needs to specify info based on race, given that everyone's socioeconomic status is not equal. And I would like to take time to acknowledge my faculty mentor, Professor Veronica Sovero, and I'd also like to extend a thanks to the Honors Department for making this research opportunity possible. And thank you, that's it.
Great job, Jaianna. Thank you so much. That's great research.